Republican lawmakers released a new batch of Dr. Anthony Fauci's messages discussing COVID-19 vaccines for pregnant women. In the exchanges from January 2021, the former head of the National Institute of Allergy and Infectious Diseases said that there was no data or theoretical reason to believe that vaccinating early versus later in pregnancy would be preferred. In another exchange, Dr. Fauci said, in any vaccine in which data are lacking in pregnant women, one must weigh the potential risks against the benefits. Dr. Fauci has not commented on the released text. I'm joined now by Dr. Céline Gounder, CBS News medical correspondent, editor-at-large for public health at KFF News. She also served on former President Biden's COVID-19 task force. So the CDC formally recommended that pregnant women get the vaccine on August 11, 2021. What do we know about the COVID shot and pregnant women now?
Well, at that time, we already had gone through a pandemic, had to administer a new pandemic vaccine to pregnant women. So this was back in 2009 for the H1N1 swine flu pandemic. In the aftermath of that, Denmark followed some 54,000 pregnancies and saw no increase in miscarriage. The question of fever in pregnancy was also answered in 2002 in 24,000 pregnancies, and there was no link to pregnancy loss. Now, what have we learned since then as to the safety of COVID vaccination during pregnancy? This has been answered. An analysis grouping 21 separate studies involving almost 150,000 women found no risk in miscarriage. France also followed 130,000 first trimester exposures, so vaccination during the first trimester, and found no increase in birth defects across 75 different categories. So we can say not only did we have good reason to believe COVID vaccination was safe at the time, but also we have evidence now that that was indeed the case.
So a lot of people, scrolling through the social media feed are saying this is the gotcha, this is it. But how does your trained eye read something like this? Because to me, a doctor is going to tell any patient, whether you're pregnant or not, whenever you're considering a vaccine or any kind of treatment, you have to weigh the risks with the benefits.
We say that about everything, not just vaccines. We say that about diagnostic tests. We say that about treatments. So it's really not any different that you would be weighing the risks and benefits. And we also know and knew actually by this point that infections like influenza, COVID, during pregnancy could be disastrous both for the mother and for the baby. Many of these women ended up in the ICU as a result of complications because during pregnancy, your immune system is tolerating the pregnancy, may not be able to fight off infection as well. And the pregnancy is also pushing up on the diaphragm, so you're not able to breathe as well. So, I think, yes, you need to weigh the risks and the benefits, but at that time, it made sense to move forward, and the evidence we've gathered since then only reaffirms that.
Dr. Céline Gounder, thank you.